Hi, this is Liberato Martinez. Thank you for joining me. I'm here to help you on your Medicare journey. Today, we are going to talk about Medicare Advantage plans, and we're going to go over the good, the bad, and the ugly. Yes, that's right. Just like the old spaghetti westerns, we're going to talk about the good, the bad, the ugly, and we are going to educate you on Medicare Advantage plans so that we can help you make a good choice. Now, some people love Medicare Advantage. You need to go Medicare Advantage plans. Some people hate Medicare Advantage plans. It's that crazy of a topic. But it comes down to you being educated so you can make the right decision. It really depends on you, your geography, and your needs. So let's go ahead and get started. So let's go ahead and talk about just real quick, original Medicare. You have your Medicare Part A in general, and your Medicare Part B. In general, Medicare Advantage plans, also known as Part C, replaces original Medicare, replaces your Medicare Part A and B, and Medicare Advantage takes over your health care. So when you go to see your doctor, you only have to present one card. You can actually take that red, white, and blue card, and you can just store it in a safe place for future reference if you need it. You just need your new Medicare Advantage card. So let's go ahead and talk about the good. All right, the good guy in the Western, you know who he is, Mr. Eastwood. He comes in and saves the day. The good part of Medicare Advantage. In most areas, in most cases, depending on your geography, the premium is $0. Could be a little bit higher, but in most cases, $0. Also, Medicare Advantage includes your Medicare Part D. D like drug for your prescriptions. So that's a good thing. And the zero cost includes your prescription plans. You just have to pay your Medicare Part B, be like boy. And in 2024, that is $174.70 per month, the standard rate for most people. Now, I hear this all the time. This is too good to be true. What's the catch? Well, here's how it works. We're going to talk about the bad and the ugly, but why it's really not too good to be true. Look at it this way. You've been paying into Medicare all your life. You had that first job in high school. You saw that Medicare line. What the heck is Medicare? Don't worry about it. Well, now it's time to take advantage of the benefits because I'm still paying into Medicare. My kids are still paying into Medicare. And our intern who's in college is paying into Medicare. Come here, Alexa. When you see your paycheck, do you see a line that says Medicare? Thank you, Alexa. That's Alexa behind the scenes. She's helping us with our YouTube videos. We appreciate her very much. I appreciate you very much. Sorry to cut you off, sorry. But we're all paying to Medicare for your health care. Now, in addition to that, original Medicare subsidizes the insurance companies, and they help pay for your Medicare. So all of this is happening behind the scenes, and Medicare Advantage gives you a low-cost option. Now, more good about Medicare Advantage plans. It gives you extra benefits like dental, vision, hearing, gym memberships, over-the-counter transportation, and more. However, just a big watch out. Coming down is the Inflation Reduction Act. It's going to kind of change the landscape of how insurance companies do business. We have another video for that. You can take a look at that one here. So be sure to look at your annual notice of change, that ANOC. Do not throw it away this year. Take the time to read it, and we can see if there's any changes that we need to address for next year. And don't forget that these benefits are for a calendar year. So when we come up on annual enrollment on October 15th through December 7th, you can change your plan from one Medicare Advantage plan to another, or go back to original Medicare and then go to Medicare Supplement if applicable. So look out for that because there could be a lot of changes. All right. Now let's go on to the bad. One of the things that is part of the bad is that there is a doctor's network, whether it's an HMO or a PPO. You are committed to the doctor's network. So if your doctor leaves that network, it does not create a special election period. So you may have to find a new doctor. So that could be a bad. That's a watch out. The other thing that could be considered a bad, and the good, the bad, the ugly, is copays and coinsurance. Unlike Medicare supplement plans, there are, at least the Plan G, there are copays that you may have to pay. Now, in a lot of cases in different areas, the copays could be $0 or very low. Or you can go into coinsurance. You know that 20% coinsurance that you have in your Part B, you could be responsible for some of that. However, there is a maximum out-of-pocket that will protect you. It varies widely. I've seen them as low as $200. And the maximum, and in some areas, depending on your geography, the maximum for the maximum out-of-pocket is $8,850 this year in 2024. So that is kind of the bad. Now, let's talk about the ugly. This is kind of some really hot buttons here. One is that now that you are in managed care, because that's what a Medicare Advantage is, it's managed care, that's why you have a network, you could and may need to get prior authorization for high-cost treatments. Things like surgery, hospitalization, chemotherapy, dialysis. And if you are denied, because it would go up to review, and if it's denied, then you would have to file an appeal and see if that could get approved. So that is a big watch-out when you go to a Medicare Advantage plan. That's one of the big uglies, okay? Now, another ugly is that if you want to switch to a Medicare supplement plan, you may have to go through underwriting depending on your geography and where you live. And quite possibly, if you go through underwriting, you can be denied a Medicare supplement plan due to your health. So when you turn 65, you are in your Medicare supplement open enrollment period, which is a guaranteed rights period where you are guaranteed to get that Medicare supplement plan. And after that open enrollment period is over, you could possibly have to go through underwriting. So there are some exceptions to the rules. It depends on geography. Let us know if you have any questions on that. But that is the ugly. So the uglies are prior authorizations and possibly not being able to switch to Medicare supplement plan due to health reasons and underwriting, possibly. So you need to know the good, the bad, the ugly, so you can make a good decision. Because in some cases, Medicare Advantage is just right for you. In some cases, original Medicare and a prescription drug plan is right for you. And in some cases, Medicare supplement and a prescription drug plan is the right thing for you. So just remember, we are here to help you. Give us a call if you have any questions. And hey, as always, that's payback. As always, don't forget to smash that subscribe button and like and forward and share this and tune in for our next video. Have a great day.